Dear all, it's time to crystal gaze into the future of health tech. We are delighted to bring to you two industry stalwarts, Dr. R.S. Sharma, CEO, National Health Authority, and Dr. Devi Prasad Shetty, founder and chairman, Narayana Health, to discuss the future of Indian health tech. Senior bureaucrat and former TRI chairman Dr. R.S. Sharma is at the helm of the National Health Authority, an autonomous body which is responsible for implementing India's $1.43 billion public health insurance assurance scheme, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. He has served as the chairperson of an empowered committee for COVID-19 vaccine delivery technology platform, CoWIN. Along with Mr. Sharma, we have Dr. Devi Prasad Shetty, the world-renowned cardiac surgeon, best known for making cardiac surgery affordable to the common man. He initiated the concept of micro health insurance scheme in Karnataka, which eventually led to the Karnataka government implementing the Yashaswini scheme, a micro health insurance scheme for rural farmers. Dr. Shetty is the recipient of a number of awards and honors, most noteworthy being the Padma Shri and the Padma Bhushan Awards in 2003 and 2012, respectively. Dear audience, we would like to invite you to a free-willing fireside chat with Dr. R.S. Sharma and Dr. Devi Prasad Shetty. Joining the chat with them is Mr. Pradeep Gupta, Chairman, Cyber Media Group.
Good morning, delegates, for today's session on transformation in healthcare. And it indeed is we actually having this session because today we are celebrating, a landmark in terms of vaccination, right? You must have seen in the newspapers today great announcements that are being made about the 100 crore mark having been crossed. So it indeed is a great day. And I think it's a great time for the health tech industry because, the last 2 years have been absolutely transformational as far as this industry is concerned. There are a lot of changes that have taken place. Biggest of that is the mindset change. So, a lot of places technology was there, but it was not getting implemented because of one reason or the other, some regulatory issues, some industry issues, and so on, but it was not getting implemented. But because of the pandemic, suddenly it accelerated a complete shift towards technology. And I think we have witnessed the sort of change that has taken place in terms of, whether it is devices, whether it is innovation in innovative technologies, whether it is affordable healthcare, in terms of the entire infrastructure, the healthcare providers. It's been absolutely, the last 2 years have been transformative as far as this entire industry is concerned. And I've got two fantastic people to share, what has happened and what is the current and what is going to happen in the future. So welcome Mr. Sharma and Dr. Shetty for today's fireside chat. Let me start by looking at the last 2 years. The pandemic redefined a whole lot of places. And Mr. Sharma, let me start with you. We were, of course, caught on the back foot, but then we reacted and we put tracing mechanisms and, we put together the entire vaccine program and so on. So would like your opening remarks on what really have been the transformative things as you see them for the last 2 years.
Well, thank you very much, Mr. Gupta, and good morning to all of you and Dr. Shetty. It's a pleasure and privilege to share the session with Dr. Shetty, who is I think doyen in the Indian medical space. I am basically a complete newcomer. I have never worked in my 42 years of my life or career. I have never worked in the health space. But then probably I am so lucky to be really working in this field. And at this particular point in time, when health has become so important and everybody has realized the importance of health. And the last 2 years or 1.5 years have been real trying period for our country and also for the whole world. As you very rightly pointed out, what has happened over the last 1.5 to 2 years is that while there have been real crises in the health space, there is one area which has really gained quite a lot of ground and which has become quite which has accelerated, adoption of which has accelerated, and that is information and communication technology. So take, for example, the digital payments. Now, because people were saying that the currency notes also have some virus and, so it's better to accept the digital payments. And of course, people are doing more things online and therefore digital payment acquired a currency. So the statistics of digital payment, if you look at them, last month we had 3.4 billion, UPI transactions, totaling more than 600,000 crores. So this is the level at which, digitization has gone in the payment space. Similarly, on many other, areas, we have seen more and more use of information and communication technology. The current example where all three of us are sitting at different places and your audience is also sitting at different places in the comfort of their homes or their office. And we are connected together and virtually feeling as if we are sitting in the same room across each other. Now, that's another example of how adoption of technology has happened. It's not as if technology has come in the last 2 years. Technology was there. Telecommunication, video conferencing, all these technologies were there, but they were not really acceptable and adopted. So somehow circumstances have forced us to adopt these technologies. And I think that is something positive coming out of this such a hugely negative stuff. So this is something I see as a very fundamental change which has happened. And I think this change should not be abandoned. It should not happen that, once the pandemic is over or its intensity reduces, or people start sort of thinking that, okay, this is there, but it will remain with us, as they say, endemic or whatever other term they use. So it's like influenza, this whole thing will remain, but it will not be so fatal, it will not be so dangerous. And that is how, we can abandon the technologies which we have started using. That should not happen. I'm not saying that physical meetings should stop. I'm not saying that traveling should stop, economy should stop. No, not at all. But I think wherever we can optimize on the travels, on the expenditures, and on other things, we must do it. And that, I think, I see as a great ray of hope. Now, for our country especially, it is very important because our country has the problem of, accessibility of healthcare systems. Now, I agree that every service in the health cannot be delivered through technology, but I'm sure many services, except probably hospitalization, operations, and other kinds of things, everything can be delivered.
Mr. Sharma, on the delivery part, let me...
Yeah, I understand. But what I'm saying is that from my perspective, I see this is a great time for us to start leveraging technology in a very big manner.
No, absolutely. And Dr. Shetty, yes, indeed, as Mr. Sharma said, and you have said several times that the pandemic is becoming an endemic and so on, but there are technologies that have moved in, right from whether it is the front office, when a patient walks into the hospital, we've seen robots being used and stuff like that, to whether it is the entire ecosystem of diagnostics and so on. So what are some of these tech transformations that are very stark in the last 18 months?
First of all, I would like to let Dr. Sharma know that he always looks at himself as an outsider for the healthcare industry. But I just want to remind him that every industry is disrupted by the outsiders, not the insiders. So the government has the wisdom to choose the right person to disrupt this industry, Dr. Sharma. So with your vast breadth of knowledge in other areas, we believe you will bring a breath of fresh air to this industry. First of all, Mr. Gupta, the 100 years from now, when somebody is writing the history of Indian history, there will be two periods. One is BC, that is before COVID, and other one is AC, that is after COVID. Because everything what we see in this world, in this country, will be dramatically different. Every aspect of delivering healthcare will undergo dramatic change. And that change, foundation will be built on the technology. Because compared to any other industry, healthcare industry is the ideal industry for digital disruption. Because this is one industry which runs only based on the data. When you hear somebody is unwell, 95% of the people who are unwell do not need surgery or they don't need any fancy intervention. The decision to treat them is based only on the history of the patient, what he's suffering from. That can be obtained online and by interpreting various data of medical equipments, which again the data can be transferred. That is, technically 95% of the illnesses can be treated online remotely. And that was possible around 18-20 years ago, before anyone could hear the cloud. What cloud was, everybody thought cloud is the one which brings the rain. I was sitting in this office here treating patients in remote locations of India, in Siliguri, Bankura, all the African countries, thanks to Indian Space Research Organization satellite. And this country has the capability to make all this happen. So essentially, we are blessed in living in a country which is blessed with the phenomenally skilled software engineers who can create amazing product. Only thing is, medical professional like us should have the patience to sit with them, understand, and ask them how they can help us to improve our day-to-day life with the patients, rather than dictating them what we want. So essentially, I am convinced that with the digital disruption, healthcare will become safer for the patient, and it will become accessible, and it will become affordable. I have no doubt about that. And I can tell you, Mr. Gupta, in the next 1 or 2 years, when you walk into a hospital, you will have a reception without any receptionist. Because all the work done by the receptionist would have been done previous day by receptionist staying at home online. And when you enter the ICU, there will be ICU with no intensivist. Intensive care unit without intensivist, because intensivist is at home managing the patient remotely with better outcome. There will not be few hundred people running around with blood sample and taking one IV fluid from here and there. Everything will be transported by very inexpensive robots, like virtually toy robots carrying material. Because it's today, with this kind of a vicious infections going around, hospitals are not safe for the people who are not going to touch the patients. So all this technological disruption will happen soon. And I'm convinced that that will happen in a country called India.
That's wonderful. And I think, India, our parents always sort of said either you became a doctor or you become an engineer. And today we are actually seeing the marriage of these two things taking place, technology coming in healthcare. So I think, indeed, it has the power of huge transformation. Mr. Sharma, now let me talk about the delivery that you started alluding to. And so, and especially in terms of affordability, because I think that's a very important issue. In India, so far healthcare is associated with affluence. So can we break that sort of a connection? And can it benefit rural India? Your views on the delivery?
Well, Mr. Gupta, I think Dr. Shetty has raised an extremely important question, and I would like to spend a little bit of time on that issue of data. I think very, very important part, because data today is the not only the raw material, it's actually the currency. It's actually the most important part. Data has been traditionally, the records, the previous records, previous diagnostic reports, etc. That is also a data, but that has been obvious data and information. They have been important. But in today's world, I think that has become very, very critical, because anonymized data at a massive scale can produce results and can actually draw conclusions and can really provide an expert advice, which actually can be much more valuable and less costly, and can provide a real help to the doctors in actually improving their own skills. So I think that's something which is very, very important. Talking of data in general from a global perspective, India's networks today, wheel or transport 8 exabytes of data. Now, exabyte actually is a very very large quantity. You have heard of megabytes, gigabytes, terabytes, petabytes, exabytes. So it's a huge, 10 to the power so many, I don't know how many powers is there. And our people are consuming data at the rate of 12 gigabytes per month per person. 12 gigabytes. In America, the average data consumption from the mobile networks, let me qualify that, because their consumption from the fixed line networks is much, much more. But from a mobile networks, it's very small, 3 or 4 gigabytes. People in India are watching films online, films on their mobile phones. Data is extremely cheap. Some time back, a few years back, data was 300 rupees per gigabyte. Today, the data is 7 rupees per gigabyte, 8 rupees per gigabyte. So imagine one film is at the best 1 gigabyte. So in 7 rupees, you can download the entire film and watch it at leisure, and you can distribute the film in your community and do whatever. So what is happening is we are producing data. Again, social media users talk of Facebook, talk of anything. This is there. Now the point is what this data could do. One would think that this is a useless data, but it is not useless data. It is that data due to which Facebook, Apple, Google are trillion-dollar companies. Their sort of worth is more than a country's total GDP. So this is what is happening. Now, why is it important from our perspective? You see, one very important part which we should understand is that such usage of data was being done in the Western world. But then what has happened that in the Western world, the pattern of usage of this data has evolved over a period of time, and it has evolved in silos. So you have large proprietary systems which are closed systems, which are actually just doing things for the benefit and business. India has the advantage that we do not have many legacy digital systems. Whatever are there are still in a preliminary stage. Now we have the chance to leapfrog, because we now don't suffer from because bringing digital legacies is very, very difficult, let me tell you. Breaking digital silos is more difficult than breaking physical silos. So therefore, we have a chance to leapfrog, and we have leapfrogged. And we have a chance to enable utilization of the data to the person to whom it belongs. So we have an architecture called data empowerment and protection architecture. So a patient is in charge of his or her own data. It is at her consent and her direction that the data can be shared. It can be kept in her device. And that actually is going to be, from the patient's perspective, it is going to be very valuable, because once that happens, then the cost of treatment will go down.
Yeah, and what sort of a time frame are we talking about when I know you've been working a lot on the entire health stack and so on. So, by what time would a UPI equivalent for health be available?
Look, UPI equivalent for health, it's a very common term. People have started using it, but let me caution, because UPI is a unidirectional, single dimension part, which is basically payment system. Just payment. health is a multi-dimensional issue. So therefore, and the ecosystem partners in health are quite large numbers, different. You know, you have the most modern hospitals in India, and you also have the hospitals which are just a small clinic and they don't use technology at all. So therefore, bringing together everybody on that ecosystem, convincing everybody, you see, it's not a question of forcing anybody. It's convincing everybody that, friends, this is the right way to go. This is the way you will reduce cost. And if you reduce cost, you will benefit yourself and you will benefit the patient. So ultimately, all three terms which Dr. Shetty used, the affordability, the access, and the quality, all these three things will improve using technology. And the last question which you asked, coming back to that the
time frame
will be, you know, it can be as early as a couple of years, or it can be as late as a decade, but that will all depend on how we are able to do this project together. And when I say together, it's not, you know, National Health Authority or XYZ or Ministry of Health or Ministry of Health in the state. It's actually the entire ecosystem of our medical fraternity. And that includes the hospitals, the doctors, the nurses, the Ayurvedic system,
sure.
the Indian system of medicine, the pharmacists, and everybody, including the manufacturer of drugs. Everybody has to come together. And right. I think we can do it. Believe me, we have huge amount of confidence. We have done things and we can do it.
Absolutely. Dr. Shetty, at Narayana Health, you've been using, you know, the patient records, etc., for several years. But I think, how do we make it, how do we get all the components of, you know, whether it is the diagnostic labs, the pharmacies, and, you know, how do we, what are going to be the challenges? Do you think the industry is ready to adopt to those practices, and how can those challenges be overcome?
See, situation now is dramatically different than what it was, say, 10 years ago. We believe that the entire electronic medical record will shift from the laptop to the mobile phone. And every software in treating patients will be built on a mobile platform. We will leapfrog what the US and European countries have done, where all the EMRs are developed for the desktops. Unfortunately, doctors never sit on a chair for longer than few minutes. They're always going from the operation room to the office to the ward to the ICU, and to the labs. They keep on moving. So essentially, 5 years ago, if I told my colleagues that we can see the chest X-ray in a mobile phone and take a decision to do a procedure, people would have laughed at me. Today, it is a norm. See, most of the decision in our group of hospitals are taken based on the data coming in the mobile phone. And it is such a joy. I go to bed at, now I don't go to ICU. First of all, you may think, you know, you don't go to ICU, you don't examine the patient. Every hospital has a policy that a patient in the ICU, doctor shouldn't touch. Only the doctors who are going to do a procedure should touch the patient. If I touch the patient without a purpose, I can give him infection. So the concept of touch, people have to reset themselves. Then, as I said, I go to bed at around 11 o'clock at night. Before I go to bed, I finish the ICU rounds because I have the patient's live cardiac monitor. I can see the patient in my phone. I know what the entire blood test reports are, what the other doctors felt. It is like a chat platform. See, the entire EMR will move on a chat platform because doctors take the decision to treat the patient by chatting with their colleagues. And the patient condition is very dynamic. It keeps changing. So if you have built the traditional EMR, like a transforming what you write on a paper to a digital format, it is not going to serve the purpose. So we built our entire electronic medical record on a chat platform. So there are 20 doctors in my team who are constantly interacting. So 11 o'clock, I finish the rounds. And if I have anything to say, I send a message in the chat box. By 4:30, I am up. I do the rounds again. I know exactly what has happened. Before I enter the hospital, I know exactly how each and every one of my patient is. So that patient is never away from me and from the doctors. We are not talking the future, we are talking about the current. And all these tools are developed by brilliant software engineers working in Bangalore. So these are the amazing things which will dramatically change. See, like Dr. Sharma, what he's planning to do with the National Digital Health Authority, they are going to, the National Digital Health Authority expects all of us to put our medical data into a common storage space. When that happens, there will be a massive shift in the way patients are treated. I'll give an example. Every day, thousands of CT scans are done. Every day, thousands of MRI scans are done. Angiograms are done. Now, when the test is done, we give the patient a CD. And believe me, the life of a CD is not more than 5 months to 10 months. It gets ruined before that. And once the images are lost, of course, as a hospital, we store the data. But believe me, not many hospitals have the capability to store the data in the cloud. It is very expensive. Now, if the Digital Health Authority allows all the hospitals to store the data, a patient has a CT scan today of the brain. After 5 years, he has another symptom and the doctor repeats a CT scan. At that time, the life-saving decision can be taken only if you have the two images to compare, which we do not have today. So this health authority is not only about convenience, it is about saving lives. This is one example. Like this, I can give hundreds of examples where dramatic things can happen. A patient who has a heart problem with blocked coronary arteries in Bangalore goes to Delhi, 2 o'clock at night in a hotel room, he gets chest pain. And he goes to the hospital. And the first thing hospital doctors want to know is where your medical records are. And nobody carries a medical record. Whereas if he has the link for his medical data in the cloud provided by Digital Health Authority, with touch of a button, the doctors can see the old ECG. And they know this ECG of today and the old is the same. So it is not an acute heart attack. So they may not give him a deadly medicine called streptokinase or one of those medicines, which can potentially kill him by bleeding into the brain. So essentially, we are not talking about government trying to collect the data. We are talking about the measure to save lives of precious lives using the technologies what are available. And this is the beauty of technology, how it will make a difference.
Yeah, so what essentially you are saying is that, the business forces, the market forces willy-nilly, and the benefit to the patient automatically will mean that the industry will digitize and will, use the data standards and so on. And it is not that it requires an incentive to be able to, put together it's going to be a good business decision for them to make. Am I right?
Mr. Gupta, I can tell you, within the next 3 to 4, maybe 5 years' time, smart software will make smarter diagnosis than doctors. Within 7 to 10 years' time, believe me, legally, doctors will be mandated to get a second opinion from the software before starting the treatment. Because you look at the scenario, I see a patient in front of me, I look at the films and say, you need operation. Now, is it the final verdict? Patient has a right to take the second opinion. Today, to take the second opinion, he has to get appointment from different doctors in different cities. How many people can afford it? If my software based on the data can give a second opinion and a third opinion from the top doctors by using the data, why not we do it? Believe me, it will become legally mandatory for all the doctors to get the second opinion. Will it mean, will the software replace the doctors? No way. There are planes which can fly without a pilot, But how many of us want to get into a plane without a pilot? So essentially, what will happen is these tools, what we develop, will make us safer for the patient. It will make convenient for the patient. It will make the healthcare affordable. And this is the beauty of technology.
Yeah, so essentially RoboDoc is around the corner,
Yes.
but in an assistive
Exactly.
saying. Mr. Sharma, what are some of the other technologies around the corner? Would you see a lot of virtual reality and that kind of thing being used? What about, what are some of the changes that you are likely to see on the technology front?
Well, I think what is important is, while there is the newer breeds of technology which will provide newer methods of treatment, of diagnosis, of interpretation of the diagnostic reports, etc. That is one part. The more important part is essentially digitizing the health space. And digitization itself will actually result in huge gains in terms of efficiency, in terms of accuracy, in terms of better diagnosis, affordability, etc., etc. So I think there are many low-hanging fruits, as they say, which are there, which should be leveraged to begin with. And as Dr. Shetty was saying that, these will make things, affordable. They will improve quality, diagnosis, second opinions by, AI systems. So one is that technology will improve the quality of healthcare. And what is happening is that the data itself and ultimately look, all these AIs and machine learnings people talk about, but they forget that ultimately these are nothing but certain technologies which are working on data. The more data you feed to them, the more accurate they become, the more fine-tuned they become, the more accurate becomes their analysis. So this is what is going to happen, because we are so data rich. We may be a poor country, but actually we can become so data rich. We are already so data rich. Only thing is this data has to be put into a framework so that it becomes useful. You can derive meanings out of it. You can find the data without, of course, violating the privacy and other kinds of concerns which people have.
Actually, that would be, I was going to ask you, what about the ownership concerns, the privacy concerns, the security concerns? How are those being addressed?
Right. So one is that, this is important. My other take is that there are a lot of inefficiencies in the operational part of various hospitals. And what I mean, let me put it this way, as Dr. Saab was saying that, there will be robots carrying on the, those equipments and tools, etc. What I'm saying is that there are many processes themselves which actually can be optimized, made more efficient. And, people should work and technology can come to the assistance of those processes. That's what I'm saying. So we should use technology to A, improve the internal processes of the hospital, B, to digitize the health records and the data, and C, to actually put together a whole slew of technologies which as a software as service. So for example, today, a hospital may buy a software which basically does the analysis of the X-rays, let's say. Now, if India, the country, is going to provide that as a digital public good, then, we can buy or we can get a software or AI machine or AI system, which actually can work software as service. So anybody sitting anywhere can just plug in his X-ray and then, figure it out. I mean, his X-ray means his patient's X-ray, and figure it out as to and diagnose it and use that machine, not buying it. So from a capex, you have converted that system to an opex, and that is how things must matter. And therefore, the establishment of a digital health platform, which is the Ayushman Bharat Digital Mission, acquires importance, because then, as a country, we should be able to plan to basically provide these softwares and systems, the best of them, as service. And then you can have maybe 2, 3, 4 AI systems working together. And depending on how much accurate they are, and they will develop their own star rankings and other things. The most efficient ones will survive. The others will have to struggle, and others will have to compete. So I think we can provide a very beautiful, cost-effective model of service delivery. Coming back to the question of data security and data privacy. So one is the question of what is privacy? Privacy is ensuring that your data is not used without your permission. That's one fundamental part. So consent is actually the hallmark which should be taken before using the data. That's one very important part. And what we have developed in India is we have a digital consent token. We are, consent doesn't mean that you are going to write on a piece of paper to a doctor saying that now you can use my data.
Right.
It should be hassle-free digital token which I can provide, and then the data can be seen by the doctor. Otherwise, it will become a complicated thing. And India, fortunately, has designed and delivered and deployed what is called the consent artifact. So essentially, that ensures that the data cannot be used without the owner of the data. Now, in a data world, owner is a bit of a fuzzy concept because data is infinitely divisible. It's not as if this pen is with me and this pen can be exclusively with me. It can't be with you. Data is something which can be with me, and an exact replica of that can be with you without loss of any quality. So therefore, the ownership in our context rests either with the hospital, where the patient was there, and hospital obviously has a right to keep that data, and also with the patient. Patient also has the right to keep the data and share the data. So sharing part hospital cannot do, but the patient should be able to. So this is the architecture, and of that architecture, we are ensuring that the data does not go without patient's part, this patient's consent. Secondly, the other question around security of the data. So the security of the data basically means that the place where you are keeping the data should be secure enough so that the data cannot be hacked. Now that we are ensuring by what is called a federated architecture, which means the data will not travel. It is not as if data will get deposited in the National Health Authority. No, it will be basically living wherever it is living. If it is in the Narayan Hridayalaya, it will remain in Narayan Hridayalaya. Patient will have the capacity and this thing to fetch it. And for that to happen, Narayan Hridayalaya will have to keep the data somewhere which it is accessible from. And that accessible platform can be provided by the government, can be subsidized by the government, or some other arrangements can be done. But that's how it should happen. So therefore, it is not as if the National Health Authority is going to collect all the data and put it together and become a super kind of storage or a storer of the data. That's not going to happen. So therefore, the responsibility of the NHA to that extent gets limited, because it's responsible only for the reference data, which is the data of the facilities, data of the doctors, data of the drugs. That data will remain with us, but the rest of it will all be demand driven. You can fetch it whenever you require it, and then it remains wherever it is. And the responsibility of maintenance of the privacy and security of that data will obviously lie with the data custodians, the data controllers, as they say in the data protection regulations, etc. That's how it is going to happen.
And Dr. Shetty, for that, would the entire, is there an upgrade required for the entire medical infrastructure in terms of skilling and so on?
Mr. Gupta, I just want to bring back the discussion to the fundamental stage. The fundamental situation today is a lot of private equity investors, a lot of companies are chasing various tools for building AI, MI, all kinds of fancy gadgets. But where is the data coming from? Data has to come from the electronic medical records. And over 80 to 90% of the hospitals across the world, forget about India, do not have electronic medical records. Today, when we talk about a digital discharge summary, somebody at the time of discharge goes through the entire file and they type all the reports like a typewriter and give a digital copy. That is not EMR. So essentially, situation across the world, other than US and some European countries, is like people are building fancy vehicles for a transport. Somebody is building a two-wheeler, somebody is building a three-wheeler, somebody is building, the very fancy, very fast cars, trucks, everyone. But nobody has built the road. And road is the EMR. And unless we build the EMR, all this data, what we get, they are physically entered, manually entered by people, which cannot be relied on. This is the biggest problem. So unless we all get together and create an electronic medical record for the country, which is available and accessible to every hospital, we will never see this revolution what we are all dreaming of. And that can be done in a country like India, because the cost of building that electronic medical record is tiny, tiny compared to what it will cost in US and Europe. And once everyone starts using it with the input, it will become better and better. So we will be able to make products which will be used across the world. So this is a golden opportunity we have in the country to build this kind of applications. But these applications should be built getting massive input from the doctors, because doctors are difficult animals to handle. Because one of the fundamental principles what doctors accept in electronic medical record is that there should not be a keyboard. Because imagine if you are a patient sitting in front of the doctor, and as you are talking about the chest pain and breathing difficulty, if a doctor is busy typing, it is not a good experience. He expects you to look at his eyes and understand. There should be empathy. So essentially, all the technologists must understand that the doctors are not designed by God to type. So then you create a EMR, which is based on the tapping and the voice. And once these things happen, there will be a massive shift happening. So we have a great opportunity for all the software entities, software entrepreneurs to build this electronic medical record. And without that, all the data and everything what we get is not accurate. You can't build any AI tool based on that.
Dr. Shetty, we are coming to the close of today's discussion. So, it's a very interesting thought that you've given, that, Indian software has powered the entire world. And it is the Indian doctors which are powering healthcare systems all across the world, in the US, all developing countries, everywhere. So is it time now for us to see the marriage of these two, and can India actually become the center for healthcare technology for the entire world?
See, I have no doubt about what is going to happen. I'll give a simple example. You see, the Facebook, one of the largest content owner, doesn't create any contents. Alibaba, world's largest retailer, has no inventory. Airbnb doesn't own any hotel rooms. The Uber doesn't own any cars. Largest healthcare provider in the world, it will not have any beds. It is going to be a software. And that software, I believe, will be developed in India. I have no doubt about it.
And closing remarks from you, Mr. Sharma, on, and especially, because you've worked at the grassroots level. So, would like to know how this has the power of transforming not just India, but Bharat.
Look, I am, one of those persons who believes that technology can solve many of the India's hard problems, if not most. There are many problems, of course, technology cannot solve, but I think most of the problems, many of the problems, or even, many parts of those problems can be solved by technology. If appropriately applied, understood, because technology ultimately has to interface with human beings. And technology without the understanding of human behavior, human nature, how does a person feels comfortable with with using the technology is very, very important for us to replicate that idea, to really permeate that idea, to convince the person. As Dr. Shetty rightly said, that typewriter is, typing by a doctor is not what is desirable. In fact, to put it more generically, I would say data should be a result, a natural result of an activity. Data entry or data creation should not be an activity in itself. This is very, very important to understand. So therefore, I think what is required is that we have appropriate technology appropriately deployed, and we should spend some time in its design. And that is why designing any system, for example, COVID we designed, while we had to design it in a few days' time, but still we had intensive discussions on the usability, inclusivity, replicability, scalability, interoperability of the software. So that I think is very important. So designing systems is very important. Human interface of these systems is very important. And one last is that India definitely has the capability. We have done many things in the past, and now we have a huge amount of confidence. And we also think that, look, we talk of medical tourism. We are having, one of the most cost-effective system. We have the most qualified doctors in the world. So I think what is required is provide that a technology interface, technology support, and the power of technology to aggregate millions and millions of systems and really produce a wonderful experience for the ultimate customer, which is the patient. That I think should happen. And my belief, I also completely agree with Dr. Shetty that we can see a huge revolution or huge transformation in the health space, provided, again, this proviso is very important, provided we all work together, in a consultative manner. I must not think that I am the most knowledgeable person on technology. I can be knowledgeable person on technology, but then technology has to work with people, with the doctors. Technology for the health space will have to work with the health service professionals, not really technologists. But I also believe that the innovations nowadays take place at the intersection of two disciplines. And that two disciplines are technology and health. And I think intersection will really produce revolution. Thank you very much.
So in this AC2, as it were, the after Corona year 2, is when, we are really witnessing this transformation of technology and, we are heading into a new era where it is not just within India, but globally, technology driven by Indian doctors and Indian engineers can actually have the power of transformation. Thank you very much. It's been a fantastic discussion. Thank you very much, Mr. Sharma. Thank you very much, Dr. Shetty, for a very, very invigorating discussion. Thank you.
Thank you very much.
Thank you. Thank you. Thanks. Thank you.
Thank you, Dr. Shetty and Dr. Sharma, for the thought-provoking and such an enlightening session.